The following is a presentation of Project Independence and WCWP. Project Independence is the Aging in Place initiative of the town of North Hempstead.
Welcome to Project Independence and You.
Good morning and welcome to Community Talk Radio. This is Project Independence and You on LIU Public Radio. I'm your host and producer, Kristina Liu, along with my co-host today. We have a full house. We have Otto Los and Paula Ewell. Paula and I work together at the Department of Services for the Aging, where she is the Deputy Commissioner, and Otto Los, fan favorite, everyone knows, volunteer supporter, friend of Project Independence. And we're really excited because this morning we have the privilege to interview John Kelly, who is a Supervisor of Social Work Services, Military Liaison Services, Northwell Health, quite the mouthful, John, and Patrick McCaffrey, who is a Veteran Service Officer. And we are talking all about Northwell Health Military Liaison Services. So thank you for joining us. Good, I'm so glad.
That was very in unison.
See, Otto's already impressed.
We got to get in step. Yeah.
Right. So, Otto, I'm sure you have a whole list of questions.
I do actually, but why don't we just start with the basics? Like, what is the Military Liaison Service of Northwell? You know, top level.
Absolutely. I'd be happy to talk a little bit about that, Otto. To really understand where we currently are, we have to understand where we've come from. And the reality is Northwell Health has been involved in the veteran community. Beginning in 2006, we entered into a public-private partnership with the Department of Veterans Affairs out in Bayshore. We opened the Rosen Family Center of Wellness in Rego Park. And this was to answer the need for family supports. It's not just the veteran returning, but the family as well. So we continue to reinvest in the community and continue to up our support of the veteran community. And that speaks to not just the veterans that Northwell does employ, whether they're reservists. We actually have a program where if you are a reservist and you get called and you answer the call for the nation and leave your job, it's pretty well known that Uncle Sam doesn't pay nearly as well as the private sector. So what we'll do is we'll make up that individual's salary difference. And our CEO himself, Mr. Michael J. Dowling, will present that check, because what we really want, we want our warfighters not worried about the finances in the rear. We want them focused on the mission at hand so we can welcome them back to Northwell. The department itself really is about two years old, coming up on 2 years. And we divided it up into 3 pillars. So the 3 pillars is exceptional care. Northwell Health is known for its health care, whether it is primary care, specialty care, mental behavioral health services. We can really answer the mail on all of those fronts, from northern Westchester out to the tip of Suffolk, the 5 boroughs, Nassau, everything in between. But moving forward, you know, we know a little bit about our veteran community, right? You're a veteran, I'm a veteran, Patrick's a veteran. So we probably understand that veterans treat their bodies more often than not like old cars, right? They'll pull it into the shop if something's falling off, but we really want to be more proactive with wellness, more proactive with health. So what we do is we ask a very simple question when you come into our facilities. Have you served? If the answer is yes, would you like some more information?
So somebody like me, who was a veteran from the 1950s, would be eligible to go to Northwell?
Of course.
Seek services?
Absolutely.
Really?
And, you know, it's not really much of a program, right? There's really no eligibility requirements, because Northwell, unlike the VA, and I'm not going to, you know, politicize that comment, it's the VA is designed for our veterans, right? That's what it's for. Northwell, you know, accepts everybody. Everyone's welcome here at Northwell. So regardless of veteran status, you know, we encourage everyone to come and see our great physicians, exceptional care. But the reality is we have to kind of be a little more proactive with the veteran community. And the fact that our team are veterans and veterans of service, you know, we can join with them. Or for all the social workers listening out there, we're going to join with them. And it's really instantaneous when you talk about the veteran community. I've known you for about
Yeah, I mean, I
3
think
minutes.
I had that on my notes here. If you've been in the service, you understand a little bit better than somebody who hasn't been there.
Agreed.
And that's nothing pompous about that.
Nope.
It's just an experience
just a fact, right?
that
Yeah.
you
You
get
know,
that you can only get if you're there. you know?
right. And it speaks to that cultural competency, right? And, the idea is, if you're a cop, you can't understand me because you're not a police officer or something like that. The veterans kind of feel that way too. And the reality is, while I go down my little social work hole, is, post-traumatic stress affects the general population. People can get TBIs in their garage. It's not exclusive to the veteran community. Human emotions like anxiety and depression and things of that nature are not exclusive to the veteran community, but it's the optics of it. If the veteran feels more comfortable talking to someone who's been there, done that, got the t-shirt,
I like that.
they're more likely to open up and share.
In my view, it's very generational in the sense that when I was in the service, I was drafted. So I had a choice, but not really,
Voluntold.
I pushed my draft up and I got drafted early because I wanted to do it and get it over with. That was the mentality.
Right.
And probably 2/3 of the people in my age bracket were either in the military or veterans or whatever, as compared to today, when the number of veterans is quite limited. A lot of people probably don't even know somebody who was in the service now. So I think that changes the game quite a bit, and that it used to be more, you had American Legion,
Sure.
VFW, whatever.
Yeah.
These were all these places where people would congregate. And now there's a lot less veterans. So I think they're more secluded, if you will.
Yeah. And, our boss, Mr. Juan Serrano, who's really the architect of this, this whole department, likes to say that veterans are more camouflaged than they ever were during their service.
That's a good way to put it.
So
You
it's such a
know,
good way.
and the reality is that's why we have to ask, right? From our perspective, no other healthcare system on the island or even in the nation is asking, and that information is beneficial to the physician examining. If you were in Vietnam and exposed to Agent Orange,
Yeah,
wouldn't
that could
from a
impact a lot of things,
diagnostic
right?
perspective, that makes sense,
Huge
to
difference.
understand that. It's the same thing with the Marines on Lejeune and the Navy that was on Lejeune drinking the water. More of today's veterans that have been exposed to the burn pits and the burning of fecal matter, just the ambient air in places like Afghanistan and Iraq are deemed toxic. They're just full of carcinogens. And, our veterans are coming back, and speaks to that point where they're not necessarily raising their hand saying, I need help. They might not even know, to be perfectly honest with you.
Exactly.
So we're going to take a proactive approach, and we're going to call them and offer our services and just really help navigate the Northwell healthcare system. It's quite large, naturally, with 23 hospitals, over 900 ambulatory sites. Where do you go? Are you computer savvy? Do you want to trust your healthcare to a computer algorithm? We're just going to make it a little bit
Yeah,
simpler.
I
for
mean,
you.
just you two guys, from reading, and I know you both were in the Marines,
Yes, sir.
Yes.
which happens to be a division of the Navy, of
Yes.
course. But
Yes, it's Department of the Navy. We
Yes,
like to
yes.
say
He's
the
like,
men's
he's just
department.
trying to toot his
The
own
men's
horn
department,
over
yes,
there.
we understand. Semper Fi devils that are listening out there.
But you, John, in particular, a very unique combination of being a social worker and a Marine.
Yes,
Those
sir.
two usually.
I know you're in
don't
good
go-
company. You have
Yeah.
two
they
social workers
usually do
here.
Not go together, all right?
Oh.
And, it's unique. And Patrick, on your behalf, I wanted to ask you, you talked about the burns before. I know you were exposed to the burn pit problem. And that is something that a lot of people probably don't really get.
Mhm.
So I know you're not afraid to talk about it.
No,
So
not
could
at
you
all.
kind of give us just a little, and my point of bringing it up is this is the type of thing nowadays that Northwell Military Liaison gets involved with. I don't think this kind of thing existed back in my time.
Yeah, no,
Yeah.
I would have to agree with you on that one,
Yeah.
because it's with the changing of technology, the passing of new laws. The Heath Robinson Pact Act was passed about 2 years ago, which is the VA's promise to address comprehensive toxics with veterans who have exposed to any of those chemicals or JP8. We're talking burn pits, we're talking Agent Orange, herbicides, Camp Lejeune water. So these are all, it opens a whole plethora of services for healthcare and also the potential for benefits to get compensated for these
Right.
exposures. And in my opinion, it's probably the biggest piece of legislation that's passed to benefit veterans in the past probably 3 decades. And it's opened up the gateway. I mean, now we have over almost 2 million claims submitted within the past 2 years.
Wow.
Almost
Yeah.
$6 billion awarded to veterans for compensation of injuries, things like
Wow.
that. So there's a huge portion of veterans now that are coming to the VA and coming in and realizing that they have eligible, conditions that make them eligible for these services.
I mean, even if you weren't in a combat, let's say, all right, my understanding is that this burn pit exposure is like a big football field that you can
Yeah,
expose.
absolutely. So it's not just you have to be in zone, in the combat zones or in theater, so to speak, where they're doing the active burning and stuff like that. So for potential, let's say for Agent Orange and my era, burn pits, we actively were burning right there, but it's not necessary that you have to be the one to actually set the fire. You can just be in the zone that the VA has designated and you have been potentially exposed. And there's a bunch of conditions that range from that. And it's something very, minute to allergy symptoms like sinusitis or rhinitis to something major like lung cancer or
Yeah.
Parkinson's disease. There's a huge range of ailments and issues that are now being addressed, and veterans can get access to services for that.
But these fires are, from what I understand, made up of ammunition, radios, cars, fuel.
Yeah,
And
so
it's one big fat pit.
there's a bunch of burn pits, so to speak, all
Right.
throughout the let's say areas of conflict wherever we were, but not just on our side where we're burning our old ammunitions, old fuel, computers. I mean, you name it. If we have to get rid of it, that's how we got rid of it. But
Wow.
it's the population as well. So over there, it's not necessary that they have a waste munitions. A waste site that they actually have, people taking their garbage somewhere. Over there, it's where I was anyway in Iraq, is very normal to throw your stuff in a ditch and just burn it. And that's the regular civilian population. So imagine that coupled with everybody else
Oh
in the
my gosh,
military
yeah.
operations wise, you have to make sure that we don't allow our gear to get into the enemy's hands as well. So
Yeah,
a lot of
it's
that
not
stuff.
like a bonfire. This is like heavy duty stuff that's gets
Yes,
burned up.
yes.
Yeah.
And majority of the time, from my experience, I was over there and we burned it with fuel. So we used diesel fuel to just get rid of
Yeah.
everything, and
It's made it even worse.
even worse.
Yeah.
Yeah. And so you're living around it 24/7. If you're not burning, other individuals are, but through those exposures, that's where we're finding out that a lot of veterans are coming back with all types of conditions.
You know,
Are
the
veterans
only thing,
protected while they're doing this? Is that, do you get like special gear to wear while you're doing it, or that is,
Very good question.
I don't
Very
know, I'm
good
just trying to
question.
picture if I had to do that, why would I, is there,
So in my,
Yeah.
so to speak, time when we were just going to take the garbage out,
yeah,
there was no
Yeah.
hazmat. It was just,
Wow.
hey, take it out, throw some fuel on it, burn it, and
Yeah.
walk away. Now granted, in the larger scheme of things, where they had like, bigger bases
Yeah.
and like the football size burn pit, I'm sure they had some sort of protective gear, but
wow.
that was a
I
second
think too, is
thought
like
to
those
me.
things are just like lingering. I'm thinking about that
Yeah.
picture,
Yeah.
even if things like not burning immediately, just in the atmosphere. And I think this is like, I'm sitting here, like, that's why these programs are so special. I'm so happy that you guys are here to do that, because I know so many young vets who, probably suffer with these things and are probably not correlating
Mhm.
that that's from being around that,
Right,
so
right.
it's
Not putting
so,
those pieces
I think that
together.
half the battle is getting people, we always say on the show, getting people connected and just educated about what they're entitled to for, everything that
you
they've
would
done.
think that we would have known better, because if you look back in my
Right.
generation, okay, smoking, doctors
Right.
said, Chesterfield's is better than Old Gold's
Right.
or whatever. We didn't know better. And
Mhm.
you would think that by the time we got to this stage,
Yeah.
that we would know better, that burning all this kind of stuff creates air that's just not good.
Well, I would say if you blow out a birthday cake in your dining room, and you could probably smell it in the living room, right?
Right.
So,
Yeah.
Exactly.
you know,
exactly.
it's one of those things,
Yeah.
and we don't know what we don't know,
Yeah.
and it is unfortunate, but you know, to your point, Christina, we're very excited at Northwell for this legislation because it really opens up the site picture for not just today's veterans who
Yeah,
are
right.
still bulletproof, you know, changing their
Mhm.
socks and drinking some extra water,
Yeah.
popping some Motrin, and they're good to go.
Yeah.
You know, the older population, I would argue, knows a little bit
Mhm.
better and understands that regular visits to a physician will keep you on the right side of the grass a little bit longer. But the youngsters, those young Thundercats getting out of the service now, they're fine.
Yeah.
And it also speaks to, you know, the challenge of reintegration just in general for our younger vets. It's all, this whole department is really built on this holistic approach, this wraparound supports that we offer our veterans, because where do most folks, you know, under the age of 65 get their health coverage?
Mhm.
From their employer.
Yeah.
Yeah.
Right.
So if you don't have an
Right.
employer,
Right.
what do you have? Who's going to hold your hand through the Medicaid process? If it's,
Right.
you know, it is means tested naturally, but you know, who's going to provide you that opportunity? Because more often than not, we're seeing small companies, large companies. You know, I think a lot of veterans might, you know, jump out of their seat when I say this, but they're like, I'm sorry, I don't see enough experience on your resume.
Oh my
Yeah.
good Lord. You make me
Well-
jump out of my seat. My God.
Well, how do I get experience?
Oh,
Would-
yeah, yeah.
One would ask. And, you know,
Yeah.
that's another element of the Northwell Military Liaison Services Department is the employment opportunities. We all know veterans bring to the table these tangible qualities about punctuality and mission first and just
Team.
working as a team,
Yeah.
stressful environments. You'll find no more stressful environment than a hospital, right? There's value into hiring a veteran.
Right.
And, you know, with an employment system that, you know, employs about 87,000 plus, there's plenty of opportunity for our veterans. We just need to find the right fit. So I would encourage everyone to also give us a call.
Yeah.
And we'll work with them on the family too.
Well,
Well, guys,
Yeah,
hold on.
that's a
Before we
question.
dive
Oh.
into anything, we're going to
Yes, some
approach a
questions.
break. I can't believe we're at our first break already. We're talking with John Kelly, Supervisor of Social Work Services, Military Liaison Services over at Northwell Health, and Patrick McCaffrey, Veteran Service Officer, all about Northwell Health Military Liaison Services. You're listening to Project Independence and You on LIU Public Radio.
WCWP is your home for great music and great conversation. You'll find all that and more on WCWP.org. Listen live on the web, check out the lineup, subscribe to podcasts, and stay up to date on the latest station events. Get in touch with us and let us know if you like what you're hearing. And find out how you can support or get involved at the only community public radio station serving Nassau's North Shore. Plus, sign up to get a free bumper sticker. It's all online at WCWP.org.
Welcome back to Project Independence and You on LIU Public Radio. I'm your host, Kristina Liu, and my co-hosts today are Paula Ewell and Otto Los. And we're going to dive back in talking with John Kelly, Supervisor of Social Work Services, Military Liaison Services over at Northwell Health, and Patrick McCaffrey, who is the Veteran Service Officer. We were talking all about their wonderful program, Northwell Health's Military Liaison Services. So prior to the break, we talked about the three pillars that are kind of part of this. So I'd love to frame that because I think what you guys are doing is such a service. So Otto, did you have a question about the first pillar? I don't want to cut you off.
You talk three pillars, and I know they
Mhm.
have their version. I just want to understand that I got it clear. You would contact Military Liaison Services for one of three things: health, which could be physical or mental; education, because maybe you need a little backup, a little support to learn something to help you on the next part, which is employment. Help me get a job, which could be with Northwell or maybe elsewhere. Is that kind of like a big umbrella?
No, you hit it on the head, Otto. Those are the three pillars. So it's what we call our life after service pillar. That focuses on employment,
Right.
you know, translating those military skills into civilian skills. You know, a hospital system is very much like a military base. Not everybody is a trigger puller kicking in doors, right? There's supports, there's admin, there's, you know, payroll, there's warehousing, and a hospital system is very similar,
Mhm.
right? So we do have physicians and we do have nurses and we do have social workers, but we also have environmental services. We have, a marketing team. We have a legal team. We have a real estate team. There's opportunity everywhere,
Like the military.
just like the
Yes,
military.
You have all of
And-
that.
Yeah.
Me
Most
personally,
certainly.
frankly, I was payroll.
Okay.
Okay.
Besides payroll, I was a decontamination man.
Oh,
Wore a suit. I was on an aircraft
were
carrier.
you on a
Gotcha.
So
mop suit?
wore a suit with a Geiger counter,
Uh,
which I never was taught how to use, but that's another.
It does sound fun though,
Yeah.
doesn't it?
Sounds about right.
Ironically enough, that was my
But I
job.
would
Otto.
walk around with my suit in this thing when we had general orders or
Yep, general quarters. Yeah.
Gotcha.
But your point is,
Yeah.
all this stuff happens in a hospital too.
Our CEO, Michael Dowling.
He's a social worker also, right?
Who is a social worker?
Yes.
Yes, he is. And my favorite Michael Dowling line, he's got quite a few of them, is, Northwell doesn't ask, what's the matter with you? We ask what matters to you.
Mhm.
And, in the military, we say things like the enemy gets a vote, most certainly, right? You can have your best laid plans, all drafted out, but you're not accounting for that unknown variable, right?
Mhm.
So the unknown variable in this case would be the veterans employees, hopes, goals, wants, desires. Do they want more training? Do they want to learn how to do something? And the life after service pillar will have that conversation with them. We'll work their resume, maybe highlight certain aspects of it and bring it from the bottom to the top,
Mhm.
or maybe just redraft it and maybe get some more quantitative information in those.
And
bullet
that's just so
statements,
helpful
whatever.
in itself.
Most
I
certainly.
mean, the idea, we talk about it all the time,
Yeah.
a resume, putting it together can be, if you've never done it or know like what, will highlight your
Absolutely.
skills is
Yeah,
such
well,
a,
I think about that. Like, I won't pick a name of any big corporation,
Mm-hmm.
but you go to a big corporation, are they going to provide that?
right,
Yeah.
right.
No, and-
No.
Your resume is going to be with the stack of
Right.
1,000 others.
Right.
Yes, and Northwell gets about 800,000 job applications a year. So,
Wow.
it pays to have an advocate, someone in your corner from the
Definitely.
inside.
Yeah.
And that's what this team serves as. And,
That's great.
And John, what's the phone number? I think it's a perfect time to like the best
fantastic.
contact.
It is 516-821-5140. And for our listeners out there, if you're anything like me and you do not like answering machines, we're fortunate enough to have some fantastic Northwell team members that will answer the call and relay those messages if we don't, in fact, answer ourselves.
Oh, great.
Because we take such a proactive approach and a proactive stance, most of our phone calls are outgoing.
Mhm.
So we don't have that fun little
Yeah.
beep in your ear.
Just thinking out loud here, this
Yeah.
phone call could come from the actual veteran, but it could come from a veteran's spouse, or it could come from a veteran's grandparents,
Yes,
Yeah.
or
Yes.
who
Mhm.
we may have listening, hopefully.
or more often
Mhm.
than not, it
Yeah.
comes from me and my team.
Yeah, who like to seek it
Fantastic
out, yeah.
social workers
Right.
that are out there. And because we've identified the ones that have come to the system,
Oh,
we
that's great.
proactively
Mhm.
engage
Right.
them. I like to say it's kind of like following them to the parking lot.
Right.
If you've ever been to a hospital, chances are you weren't having a great day.
Mhm.
They're going to give you a stack of papers, which they call a discharge
Discharge
plan.
plan, right?
And somewhere in there is going to say, follow up with your primary care physician.
Right.
Or follow up with your gastroenterologist or your cardiologist. What if you don't have those?
Right.
Yeah, right.
What if you're only in there because the ER or the ED is the only thing you know?
Mhm.
Or you're using, we have in the age of urgent cares, fantastic resources, but you're not going to get that personal
the
relationship with the
consistency,
physician,
right.
most certainly, and we want to have those primary care physicians set up for our veterans and their families. So they get to know them. They get to know, their past history, the elements they're working on, there's a care plan in place, right? You don't get that at an urgent care. You certainly don't get it at an emergency department. Emergency department is exactly that, slap some Band-Aids on it and get you out the door,
Yeah, I mean, you basically are providing super support for veterans. And I understand also possibly their spouses in some areas.
Yes, their
Right.
spouses, their children, their
So
grandparents,
their family.
Oh,
their
great.
family,
So-
everyone is welcome.
So that's a big deal.
Huge
you know.
deal.
I mean, the fact that they can count on, having a backup, like you said, an advocate who can help them go. It's a little bit like Project
I was just gonna
Independence.
say,
I
it's
just-
like you
all right,
said,
you know,
one-stop shopping.
Yeah,
Yeah.
That's
you
what
know,
you
like
said we
Project
were.
Independence, people contact Project Independence about a variety of different things.
Sure.
And they support people to help them as much as they can with whatever support they have. The other thing I did read, by the way, and easy to get into a lot of stuff here, is that you also work with 70 other nonprofit organizations
Sure.
who can provide support
Partners, yeah.
that you may not actually have, or maybe it's additional to what you have. Maybe give us a spin on that one.
Absolutely, absolutely. You know, being the big kid on the block, right, in the healthcare system is quite large. We're under no illusions that we can boil the ocean, right? We just can't. We do certain things extraordinarily well. Healthcare providing, experience providing, we do well. We're also known for our marketing. You've probably seen the signs, but
Yeah.
you know,
I would say marketing.
yeah, we're pretty good at that. You know,
You see many Northwell signs
Yeah.
out.
but you know what I always like to say, you know, when I'm on the phone with our veterans, is like, you don't come to the ER and ask for a lawyer, right? You know, you don't come to the ER and ask for an apartment. You know, there's a lot of things that we do well, but we don't do everything. So we have our community-based organizations that we have fantastic working relationships with. So if you're housing insecure, whether you're homeless or in danger of becoming homeless, we have some fantastic organizations on the island that we can connect you with. And we have these great relationships with, you know, the people with the fingers on the pulse, right?
Yeah. Would that be
So-
just for veterans, the resources you're referring to?
Dependent.
Or,
Mhm.
okay,
It's dependent. And, you know, so Patrick and I met long before our Northwell days
Yeah.
at a nonprofit for homeless veterans, right?
yeah.
It's a grant funded by the federal government. It's called the SSVF. It stands for Supportive Services
Services, yeah.
Veteran Families. And it's means tested,
Okay,
right?
yeah,
So if you're a veteran making $130,000 a year, Uncle Sam's going to tell you to go
yeah,
take
yeah.
take some money out of the ATM and
Right,
get yourself
yeah.
an apartment.
yeah,
But if you're below 50% of the AMI,
yeah.
you may be eligible for that. You
Okay.
know, unfortunately, some of these grant-funded programs, you know, have parameters in place
Right.
that don't necessarily affect Northwell,
Right,
right? Like I
right.
said, I would stand by it. Everyone
Right,
is
yeah,
welcome.
Yeah,
But you know,
no, that we have
the
same
definition
issue,
of a
yeah.
veteran, and unfortunately, I've had too many phone calls with individuals that have raised their right hand, wrote the blank check to Uncle Sam. Whether Uncle Sam cashes it or not, that's on him.
Mhm.
You signed up, you raised your right hand. As far as we're concerned, you're in. But if you don't have one day of active duty pre-September 7th, stop me if I'm wrong, September 7th, 1980, or 2 years of active duty post-September 7th, 1980, the VA doesn't consider you a veteran,
Really?
Oof.
you know, or one that's eligible for those services, right? So the SSVF
You get in a
would fall
different
into that. You
category.
get it in,
Like
you
I have
fall
a
into
card and I
different
forget
Yep.
what I haven't frankly taken advantage of, because I'm fortunate enough I can go to the doctors I choose to go to. You know, I often thought about going there for hearing aids, but
Yeah,
you know,
no,
I
the
haven't
VA
done that.
Listen, out here in Northport, which is Long Island's
yeah.
VA, there
Northwell, yeah.
are fantastic people. We
Yeah,
have great
yeah.
relationships and working relationships with them. And we're more than happy to make that warm connection from Northwell to the VA. You know, the reality is, and I don't understand, well, I don't think a lot of folks are aware that if you go to the VA and you're holding, you know, a Medicare card, maybe an ARP card,
Mhm.
well, that's what's getting billed first. So if you're holding your VA card, they're going to bill you for, you know, they're going to bill
Who's first,
Mhm.
right?
those guys first.
Right.
So if choice is something that you value, if geographic location,
Right.
something a little more accessible to
Yeah.
you, maybe your spouse, maybe your children use the Northwell healthcare system,
Good.
you know, like I have commercial product through my wife. You know,
Mhm.
she's a school principal on Long Island.
Mhm.
She has fantastic coverage. And when I use the VA, which I do from time to time, that's what gets billed.
Mhm. Right,
Mhm.
yeah,
And then the VA will become the secondary or the tertiary payer.
yeah.
So that being said, you know, Northwell has so many locations, as I mentioned in the beginning of our conversation. maybe it's a little bit more feasible for someone who doesn't feel like driving 45 minutes east.
Yeah.
Yeah.
Maybe
Yeah, I
there's
mean, it's a
one.
judgment, and it's also an
Right,
affordability thing
right.
in some cases.
Exactly.
Most
What kind-
certainly.
What kind of insurance coverage do you really
Mhm.
have?
Mhm.
But that's why I think it's so important, for someone to call up and, sit down with you guys and your team. Because, I just know, I mean, in working with seniors, Project Independence has a similar kind of, view of things. And
Sure.
it's being that advocate, and walking people through these steps.
Right.
Because I think all of us have been there. It's like, I don't want to do it. It's too much of a hassle. I don't even know how to
Yeah.
start, where to begin. I mean,
Right.
I could give you a host of all my friends. You're like,
That's
I
pretty-
can't,
That's
I'm not
right.
even trying that, and it's like you're missing out on so many things, and that could really help your life. So to talk to someone that could say, listen, and then you have those connections, maybe the VA is the right place for you, or what you want, so I think that in itself is just such a godsend of a
Well, it's
program.
like
really.
Project
And if
Independence.
you
Yeah.
don't
is
need it
exactly
now,
the
Yeah.
you'll
same
know who to
idea,
go to.
really.
That's
You
the
know,
other
and
thing
that's-
too.
yeah.
If you don't need something right now, after speaking to you, you may need you 5 years from now, because we don't know what the future is going to hold.
Well, I'll
And then
tell
they
you.
know
Yeah.
you're there. That's so important.
Mhm.
And we've
So-
found that out.
So I think most people want to make, the best decision, and to make the best decision, you want as much good information as
Yeah.
possible.
Yeah.
More often than not, and it always breaks my heart just a little bit, when I get a call, not from the veteran, but from the veteran's children,
Right, yeah.
veterans, Vietnam era veterans have children in their 40s and 50s.
Yeah.
Right.
And mom or dad may be in one of our rehab facilities, or
Yeah.
they're being discharged,
Right.
and dad was in Vietnam and he's a veteran, so what are the benefits? Is he connected with the VA?
Right.
No, he's
No.
not.
Right. Yeah.
Because
That's
now
the thing.
we got to
Yeah.
connect you to the VA,
Yeah.
which we're going to do.
Right. But that's not going to be by
Yeah.
the time you're discharged.
It's not going to
And
be.
it takes
Point of
steps, right?
It
service.
moves at the
Time.
speed of
Yeah,
government.
right.
I like to
Yeah.
say,
Yeah.
now we're being reactive, right? So,
Yeah.
thank goodness for Project Independence, and thank goodness for this radio station to get
Yeah.
the word out.
Yeah.
Because if you are on the fence and you're like, my dad tells a story about coming home from Vietnam, get in line 1 if you want to go home, get in
Yeah.
line 2 if you want to register with the VA.
Yeah.
Line 1 was pretty long,
Yeah.
Yeah.
and then they enter the workforce, they
Right.
start a family, they
Right,
buy
it's
a
like life
house,
Right, right,
happens.
and life
Yeah,
happens,
right.
and then they find themselves in the blink of an eye, you're 8
Right.
years
Yeah.
old, and you might be able to benefit from, the DME, the durable medical equipment,
Yeah. Yeah.
the home health aids, we get a lot, the VA, going to them, there's transportation, Northwell does have a transportation service.
Yeah.
You've seen them out there, they got
Yeah.
the lights and they're
Mhm.
really expensive,
Yeah.
So the VA will have, other organizations that will drive folks, Nassau County veterans. We have a fantastic relationship with Ralph Esposito and Paul Vista over
That's
there.
great. Yeah.
They'll take veterans to Northport as
Yeah.
well. So there are benefits to choosing VA as your healthcare provider. And if that's your choice, we'll help you with that too.
Yeah.
That's a
That's-
big thing to me, by the way, is you can have it as a team deal
Sure.
as opposed to you having to make a decision.
Right.
Yeah, I think a big thing that I'm hearing here is you are not alone, as they say.
Yeah.
And a lot of, unfortunately, post-traumatic stress syndrome stuff. And years ago, it wasn't really identified, but so-and-so became a raving alcoholic.
Mhm.
Uncle Norby, he was which is true. There was a
Sure.
family
Self-medicated.
member, corpsman in World War II,
Mhm.
never recovered. This type of stuff didn't go on as much back then.
Sure.
Mhm.
It was more go to the American Legion and knock off a few beers, or, and maybe talk to each other, which you did support each other.
Right.
But you don't have that now with the veterans. The current younger veterans are,
Like, is there a VFW or
Yeah, I
American-
mean,
is there
it-
something
there's just,
similar?
it's just
to
not
bring
there.
it
You know
Yeah.
what? It's just
Socially.
interesting because,
Yeah.
we can't stop Father Time, right? And the clock
Right,
keeps
yeah.
ticking.
No,
But advances of technology, there
Yeah.
are
Mhm.
more veteran groups out there
that are
than we realize.
technological.
Right.
Yeah.
That are just on social media platforms.
Mhm.
They're doing their buddy
That would
checks.
be good to know
Mhm.
for everybody.
Yeah, to promote, right.
Like if you could
Absolutely.
give them a couple of
Mhm.
like top 3 groups that people might think about.
Right. So the Dwyer project's the first one that comes
Yeah.
to
Oh, that's right.
mind.
Yeah.
That's the first one that comes to mind. That's a peer-to-peer model.
Yeah.
Where it's folks that have been there, got the t-shirt, and
Yeah.
they talk about their t-shirt sizes,
Right, right.
and that's what
Yeah.
they get together. And that speaks to that point I was trying to make earlier about veterans may look at, do you want to talk to someone like me who's got a whole bunch of tattoos that you can't see on camera,
Right.
with Marine Corps stuff on it, or do you want to talk to this lovely lady right next to
Right.
me? She may be super qualified and way better at her job than I am, but there's
Yeah,
a
it's-
perception
yeah.
of
Yeah.
it, and whether it's true or not, it's
Yeah,
irrelevant.
it's human nature, right?
Well, I
It's
mean, it's-
their
it's
decision.
Really
Yeah.
breaking down that barrier to
Yeah.
for the
Exactly.
veteran.
Especially if you're open-minded about the whole process.
Right.
You definitely can relate more to somebody who's been through what you're.
Yeah, it's the
talking
peer
about.
method, which works in so
Right.
many things.
And worse, maybe.
But guys,
Well-
we're gonna have to approach a break.
Oh,
Again, we're just flying through the show. We're talking with John Kelly, Supervisor of Social Work Services, Military Liaison Services over at Northwell Health, and Patrick McCaffrey, Veteran Service Officer, about all kinds of veteran services and the liaison services offered at Northwell. You're listening to Project Independence and You on LIU Public Radio.
Take WCWP with you wherever you go with the WCWP app. Listen live 24/7 to all of our streams, all from one app. Plus, call the studios directly from the app and visit our social media. Download the app through the iOS App Store on Apple devices or the Google Play Store on Android by searching WCWP Radio, or visit WCWP.org for links. The WCWP app, available now on iOS and Android devices.
Welcome back to Project Independence and You on LIU Public Radio. I'm your host, Kristina Liu, along with my co-hosts, Otto Los and Paula Yule. We're jumping back into, we could have them here all day, I think. John Kelly, who is the Supervisor of Social Work Services, Military Liaison Services over at Northwell Health, and Patrick McCaffrey, who is the Veteran Service Officer. And we're talking about Northwell Health Military Liaison Services. So let's get back into the pillars. Otto, I know you were intrigued by the employment piece of things.
I am, like in my era again, which is the only way I can relate. If you were drafted, which a lot of people were back then, and you had a job before you were drafted, you were pretty much assured you were going to have that job when you came back. All right. It was a different planet. I worked for a big insurance company in downtown New York. I came back, they gave me a job. So I didn't have to go through the hassle, if you will,
Right.
And the mental hassle of thinking about, okay, now what? I'm out of here. Now what? So I'm really interested in this, the job part of it. Is this primarily to get jobs at Northwell, or do you also direct the jobs to other places?
Well, our first, what I would say, and this is going to be really fantastic. I'm excited to share this. So I'm just going to talk about the education pillar for just 1 second, because again, we all work together. Everyone that comes into this department comes in through the exceptional care. We're going to address those needs and find out what matters to you and make sure we have that. If employment is one of those things that matter to you, I'm going to get you to a life after service team member who's going to work with you on that. But in the background, we have our education and policy pillar, and they are creating some exciting programs for veterans. And I will, speak about my most favorite one, which was the EMT program. So, and it's going to answer your question, Otto, I promise. So the EMT program, we took 18 veterans with no medical training outside of whatever you learned in the Boy Scouts or the Girl Scouts or your basic lifesaver training in the military, and trained them to become emergency medical technicians. And we paid them while they were training. And then we had them certified like a scholarship.
Yeah.
And then we had them certified with New York State and Northwell and all their credentials that they need. And now they're driving around our fancy, Northwell transportation buses, right? So that changed the trajectory of 18 different families. Yes, the individual got the job and got the position, but it changes the trajectory of the family. And we graduated them in
And the
early
people
December.
they help.
Like, think of the
Yeah.
holiday
Yeah.
season for those families. It just changed their life. Now we're doing pharmacy tech, we're doing
Yeah,
certified
that's right.
nursing assistants. And now we have our whole healthcare system very excited about that. So to answer your question, Otto, we're most impactful with the Northwell
Mhm.
positions,
Right.
naturally.
Yeah.
But we do have contacts with the Department of Labor, with some other fantastic community-based organizations that focus on employment as well. Listen, we understand healthcare might not be for everyone. That's all right. I can change a tire.
Mhm.
I could, but you know, you get the point,
Right.
right? I'm not going to be
But
applying
you
for a
could do that
mechanic
working
position
for
anytime soon,
Northwell.
right?
You could work in a place where you're working on mechanics, fixing things.
Yeah, those
Yeah.
those
Yeah.
ambulances don't fix themselves,
Yeah.
you
Right.
know,
Yeah.
and we
Right.
have fleet vehicles and all sorts of stuff going on. So, you know, these positions are there, and you know, we'll just use round numbers. Well, now we have 90,000 employees, 90,000 team members. If 3 to 4% are vacancies, whether it's retirement, moving,
Mhm.
grass is greener, whatever the case may be, we're looking at a few thousand open positions at
Yeah,
any
wow.
given time. And it's a moving target.
Yeah. Yeah.
So, you know, connecting folks, family members, their kids. I can't tell you how many times I've had a Vietnam vet, and welcome home to all the Vietnam veterans
Yeah.
out there listening,
Absolutely.
you know, that have called and be like, I'm good, John. I don't want to work another day in my life. But my daughter just graduated
Right,
nursing
yeah,
school.
Yeah.
Oh.
Yeah.
Oh,
It's great.
what's her number?
Right.
You know, like
Yeah.
let's call, let's talk,
That's
let's
important for
connect. You know.
people.
Right. That's what,
to
because you don't know.
understand.
Right.
Yeah.
Absolutely.
Right. You know,
It's
I
just-
think, you know,
It's the family.
a
Mhm.
lot of, and that's the supports we need,
Right.
right? It's our support systems. We talk about support systems in social work all the time, right? What supports are available to us? The family is a huge support. Just like the, you know, the UBHC, we have the joint partnership in Bayshore, it's Unified Veterans Behavioral Health Center, out in Bayshore. It's to address the family's needs, you know. It's a little bit darker, but if that
Right,
veteran
yeah.
is struggling
Yeah.
and
Yeah.
having a hard time, it's going to roll downhill,
Yeah.
right? It's going to impact the children. It's going to impact the spouse.
It
Where do they
impacts the
go?
entire- You're right.
Yeah.
Well, we already established they don't go to the VA. So where do they go? They go to Northwell. They go to private practices. And if we can just somehow combine forces, right, for good, it just benefits everyone. And if one of the stressors, you know, I look at it as like, put the ball under the cup, right? There's 3 cups, which ball is it under? Well, you know what? If you lose employment, you know, that's going to be pretty stressful. Now your physical and mental health is
Yeah.
going to do that. And then you know what? Maybe your housing is going to be impacted if
yeah,
you can't
yeah.
make rent. You lose any one of those things, you lose your housing. Well, you know,
Yeah.
I might lose my job now because I don't have a place to
Right.
change or whatever the case may be. It can really go south quickly. So approaching it in a holistic manner and addressing all those needs to the best of our ability is what we aim to do. And I always like to say it starts with a conversation. So the number I shared, please give us a call. And if we don't have the answer, we'll figure it out together.
Yeah.
Does
No biggie.
addiction come into the equation anywhere?
Time to time,
Yeah.
you know, time to time. And I will tell you this, you know, if you think of someone who might be addicted or self-medicating, you know, how there's that brief moment of clarity, maybe where they're willing to ask for help. I will share more often than not, it doesn't come with a random phone call from a social worker. Generally not.
yeah,
It's an onion, right? You have to peel the layers.
Yeah.
But by understanding that, hey, I don't know John from Adam. He's probably very good looking and obviously, you know, and he's got a nice
Obviously,
voice,
yeah.
but you know, I don't know him. So how could I trust him?
Yeah.
Yeah.
But if you
Yeah.
start
Yeah,
speaking
you got to
the
build that
language,
trust. Yeah.
you start speaking the language, you say a few things that, you know, helps them understand, hey, brother, I'm right there with you.
Well, I think you're like the ultimate superhero combination of being a social worker and a veteran, you know. And I think, you know, I always love, you know, on the show, just how people kind of got
Well,
into
these
things.
two
So what,
guys should wear
well,
one.
yeah, you guys should, we have a whole
Mention.
idea of branding, right? But how did you get into social work? Did you know, like, or you were just like, I got to do something?
I tell this story a
Yeah.
lot. Adelphi grad.
Yeah. Oh,
Cheers.
Adelphi, you got 2
Cheers.
Adelphis. Yeah.
Cheers. You know, I didn't even know what a social worker was.
Yeah.
I'm very fortunate growing up. You know, I
Either did I.
grew up
Yeah.
throughout the 80s and very supportive family. And after my enlistment with the Marine Corps, they have what they call inactive reserve period. So I was 4 on, 4 off, right? So they called us into Manhattan to Marriott Grand Marquis, right? And everybody in the local area goes, and it's like a last ditch effort to be like, hey,
Come
you want to
back.
come back on the
Yeah.
team,
Yeah,
one of
yeah,
those
yeah.
things. And I brought my fiance at the time, now my wife of 11 years. And, she said, your face lit up. And there's like not a whole lot of words spoken. It's a lot of barking with Marines and noise making. But it is a language, and
It's a language in itself.
and it is a language, rah, semper fi. And she's like, maybe you should work with veterans. I was like, oh, that would be cool. And I saw it as a continuation of service. My story is I went in at 28. I needed the affectionate old man waiver, the age waiver. And I got in and I got out to start my life. I already had a career before the military. And this just set me on a completely different trajectory because it was like, all right, well, how do I work with veterans, right? Very mission oriented. She's like, well, you got to be a social worker. I was like, all right, what's that? Well, you got to go back to school and get your bachelor's. I was like,
Yeah.
I was like, I don't know if I'm going to do school. School seems like young kids and I seem older,
Can I take exactly what I want?
Yeah, and that was it. And
No,
then,
ma'am.
fortunately, you can when you're in the
Yeah.
master's program, right? So, I was a one-trick pony. I wrote all my papers on post-traumatic stress, veterans, reintegration, history. It's all part of it. It's what makes us who we are,
Yeah,
right? The
yeah.
person in time, the person in environment. And, I took a job where I met Patrick, working with the homeless veteran population. It's a continuation of service for me.
Yeah.
And when you see me talking about Northwell, please don't just see John. There's 460 other social workers at Northwell. And
Wow.
on our team, the exceptional care team, we have an Army veteran who is a social worker, and we have a young lady whose brother is still active duty in the Marine Corps,
amazing.
flying
Love
what is he, flying fighter jets.
35, I think.
Yeah,
Something to that effect.
yeah, stud, and so we speak the language and we get it, and we can get it from all perspectives, from the
Right,
family
yeah.
side, from the folks that lived it.
Yeah.
And that's what's most important to me. It's a continuation of service. I don't consider it calling a patient. I don't call it
No.
a client. It's a veteran.
Right.
It's someone who's on the same team. And Otto, to your point, I get you did this before me, and I'm very grateful for all those veterans that came before us, that give us the opportunity
Well,
to
as we
serve.
are for today,
Yeah.
Yeah.
because if you didn't, where would we be?
Well, I would say this, that title, veteran, you earn it sometimes as early as 22 years old,
Right.
Yeah.
and you keep it to your
I
last
was
dying breath.
21.
21,
Yeah.
baby. That was only like what, 3
And-
weeks ago?
As dumb,
That's right.
as you could be.
Dumb as the day is long. I hear you.
Smarts didn't come with the package. at 21.
Well, we don't issue those, but the reality is you have that title throughout your life. And what's valuable to a 88-year-old veteran, a 65-year-old veteran, a 22-year-old veteran may be different, but there's commonalities. There's the service over self. What I'm asking our listeners is, it is ingrained in you to be selfless. You put others
Right.
before you, and your life experiences have highlighted that. What you do for your family, what you did for your country, it's all highlighted in a selfless manner. When it comes to your healthcare, I'm asking you to be selfish and pick up the phone and call me.
You two
Yeah.
guys would be interesting to talk to about other things, right? Like I
I don't
saw-
have, but you booked all day long.
Well,
I hope you guys
like
aren't busy.
you were in Libya, I believe, even if it was
I was looking at the coast.
non-combat
Yeah.
event, and you were in Haiti during an earthquake.
Yes.
And you were in Iraq. I mean, collectively, you would have some stories to share, which you may not be too excited about sharing. Yet, on the other hand, people really, unless you hear it from somebody, you don't get it. You read in the newspaper, okay, there's a war in Iraq. All right.
Yeah.
I'm sitting in my recliner watching the baseball game.
Right.
And there's people all over the
Yeah,
world
absolutely.
getting killed or
Mhm.
whatever, bad stuff going on. And, we as a society can get very complacent about the fact that, they're over there, all these people got killed. It's a little bit different when you're the one who's there,
Right.
Mhm.
and you see these things. it's a whole different game.
Yeah, it's a not my problem kind of approach. You know, if
Yeah,
it's
yeah.
not in your
It's like,
backyard, why should I worry about it? You know,
maybe not totally like that, but
yeah.
So sometimes they hear what really goes on.
That's the best part of my job, Otto. I
Yeah.
tell you, you know who has the fun stories? The submariners. Any submariners out there listening? Ooh, call me and just chew my ear off. I'm looking forward to it. Submariners have some remarkable stories, and you know, that's what makes it awesome. The stories are yours. You were there, and it doesn't have to be, you don't have to just come out and share your most traumatic experiences. I think most veterans, when you see them at the VFW or when you see them at the Marine Corps League or just at Eisenhower Park or wherever, you know, what really brings a smile to their face is like the boot camp stories.
Yeah.
It's
Oh, yeah.
like, it's the telling the story about Jimmy, who was just a lunatic and did this, and the hurricane party and
I could tell a lot of
you
those
know,
stories.
that's what, and you know, you can't beat the smile off our face when we
Yeah.
do that, and that's a cathartic. What was it, Yalom for all our social workers here? It talks about the cathartic release. You know, that's it.
Yeah.
Just get it out, and
It'll
you know,
get
when you
it'll
put it
feel
all
better
Yeah.
if you get it out.
right,
Yeah.
and if you just put it on the table, we can sort it out, you
Right,
know,
yeah.
over time, and that's fine. But if you just want to, you know, yuck it up a little bit, give me a call and we'll do that. And I'll get you a doctor appointment while we're at it.
Yeah, it's just
Good stuff.
it's absolutely incredible. And once again, the phone number is 516-821-5140. So anyone listening, family members also, you know, feel free to reach out to.
You know what
that.
I
Please.
think is really important? Like I every year I go to a soldiers at home golf thing. All right. That's one little
Now you're speaking my language. Otto.
organization, right? And there's all these other organizations that could support veterans. So it's kind of like, okay, I go down a list of 70 and I pick one out,
Yeah.
you know, depending on what my situation is, as opposed to maybe talking to somebody like you two guys and like Project Independence does, you know, that you have this kind of problem, that kind of problem. Okay, here's what we think the game plan could be,
Right.
you know, and you got support, as you put the words, support system for whatever path you might have to go down.
Right.
And I think that's important, you know, as opposed to looking at this list of 70 organizations that could help you,
Yeah.
but you know,
Where do you
it's
start?
like,
Yeah.
you know,
Exactly. Where do you
where
start?
do I start? You
Yeah.
know?
Having a guided conversation on the things that you're looking into definitely makes sense,
Yeah,
especially when you have, let's just say myself and John, who have walked the walk and talked the talk, right? So we have experiences that some people consider rough to talk about, but when you talk to other veterans, it's very normal conversation.
Right.
So breaking that barrier down initial for the veteran is where we do a lot on.
and
a
you
lot-
said finding out what matters to you, what,
Mm.
you know, your leader there at Northwell is become
Exceptional.
Yeah,
exceptional, yeah. I mean, the fact that you got 90,000 people working for you. I used to sell systems to hospitals, all right? They were all broke. They never paid their bills. I'm telling you the truth.
Sounds
It
like you're
would
not on
take
the
6
payroll
months.
anymore.
It would take 6 months before they paid their bills, all right? And every excuse under the book. Oh, this invoice is no good, you know, we
Right.
gotta change it and do whatever. And here you are, you're working for an organization that's got 90,000 employees. Their name is all over. You talk about marketing.
Sure.
So they must be doing something right.
Yeah.
And I attribute that frankly to your leadership.
I-
Right.
You know,
this department sits on Michael's desk.
Yeah.
He's
Oh, it's
he's
so
a
great.
huge
Yeah. Yeah.
advocate. Our senior leadership,
Yeah.
we really can't do it without their support, allowing us to continue
Yeah.
to reinvest in our veteran community. Patrick is our veteran service officer. No other healthcare system has one.
Yeah, it's just
Wow, really?
incredible.
And now we're
Yes.
training a second Patrick.
Wow, that's
So
excellent.
he'll do the benefits for you, for your family, the survivor benefits, the service
That's
connected
really
disability
important.
benefits.
Incredible.
Yeah,
And when you need that additional support for medical justification for some of these claims,
yeah,
well, he'll just send it over to John, Kayla, or Han,
yeah.
and we'll get you connected.
That's
Well,
so
guys,
great.
I just am blown away. First of all, incredible. I'm so happy to have you on. I was really looking forward to this. And I want to thank you for your past service and your current service and what you're doing. It's just incredible. Thank you, John Kelly and Patrick McCaffrey, who are from Northwell Health and Military Liaison Services, for everything you're doing. I'd like to thank everyone who listened today. You're listening to Project Independence and You on LIU Public Radio.